And now it's a privilege of mine to introduce Ray Martin. Ray is the Executive Director of Christian Connections for International Health. Many of you are familiar with that organization, and Ray is an avid, very active member of this community of faith. So Ray, welcome.
Thank you, Debbie, and thank you to Lewinsville Presbyterian Church, my home church, for agreeing to host this event. Having lived quite a few years in Africa myself, in several different countries, I'm thrilled that my church agreed to host this evening with several people from Africa talking about the challenges of AIDS in Africa. Christian Connections for International Health is a network of Christian organizations and individuals, Christian organizations and individuals working in health in developing countries. Our mission we articulate as promoting global health and wholeness from a Christian perspective. So we've been deeply involved in AIDS. Just yesterday and today, we were co-sponsoring and participating in a conference on maternal mortality and faith-based organizations. I'm shifting from maternal mortality today to AIDS this evening. So we are very privileged to have several people from Africa who are going to talk about their work in faith communities on the forefront of the fight against AIDS. We'll start with Pauline Muchina. Pauline is from Kenya, from the Eldoret, grew up in the Eldoret area of Kenya, for those of you who know Kenya, and is living here in the area now in Alexandria and works at the local office of UNAIDS, which is the UN agency that coordinates much of the global effort to fight against AIDS. She is a senior partnership advisor at UNAIDS and has a pretty distinguished history, actually, working for the Global Health Council for Population Services International. I checked your, I'd forgotten that you had been a consultant at the World Council of Churches, and I won't go over everything because I want to hear from her rather than tell you about her. But I will mention that she has a PhD in philosophy from Union Theological Seminary and a Master of Divinity from Yale University, and is a very active participant in the Concerned African Women Theologians group. And I asked Pauline to begin this session by providing a few comments and a little bit of context for what we're going to talk about this evening. So welcome, Pauline.
We are so delighted that our sisters from Africa came to the U.S. for a week of advocacy efforts in order to talk to policymakers, to civil society organizations, and to the U.S. public about what is happening in their communities related to HIV and AIDS. As you know, or as most of you know, the U.S. is the largest contributor or funder of the global AIDS response. And it's your tax money that they use to support people living with HIV and governments and civil society in order to fight the AIDS epidemic. And our sisters are here as witnesses who have benefited from the generosity of American people because they are on medication through PEPFAR programs that operate in Kenya and also in Zimbabwe. And they are here also to say that thank you for your generosity, and we pray that even as you continue to struggle in this economic crisis, that you will not forget that there are people who need your help. And especially as the U.S. Congress, as you all know, they are debating about cutting funding, especially to foreign aid. It's not just going to affect a vacuum, it's going to affect real people. And those people are some of them here, these women sitting here in front of you saying, remember that if that happens, it will have drastic impact in many people's lives. These women are also religious leaders in their own right, and they are working with churches in Africa that have always been there. You know, the churches in Africa were there even when we didn't know what AIDS was, you know, and they were providing care and support. You know, in my country, Kenya, they provide 40% of all the healthcare services goes through the faith community. They are there now when the funders are still there or the donors are there, and they will be there when the funders leave. So if we are talking about sustainability of programs, the faith-based community is so critical, and we cannot have an impact in any community without engaging the faith community. So UNAIDS recognizes that fact, and that's why we've reached out to organizations such as the Balm and Gilead that works with churches here in the United States and in Africa, to make sure that we are building partnerships that we can be effectively responding to HIV. That's why I agreed to join the board of Christian Connection for International Health, because I recognize the work that the faith community is doing, and we need to support them more. We need to give them resources. We need to encourage them. We need to build their capacity to be able to even do more than they are doing right now. Of course, not without challenges. There are many challenges, and I'm sure that our sisters will be sharing some of the challenges with you. And later on, I will also be talking to you about, what are we expecting from you tonight? Or what is it that we would really love to see you as a church stand in solidarity with us? Because I think tonight, in my opinion, is about standing in solidarity with each other. And there is no other better place to stand in solidarity with each other than in the church, you know, because we are a family of God, and we have been called to be together and to care for those in our midst who need help, and to stand in solidarity with people around the world, to proclaim justice. And the way we proclaim justice is not only by talking, but also by acting and putting our words into action so that we can change the world. And the world is changing, and it will continue to change. Even stopping the AIDS epidemic is possible. And I actually strongly believe that the faith community holds the key. If only we can listen also to what science is saying and implement that also in our faith community, and also the faith community to do more than they are doing right now, we will see a revolution. And in fact, we will see a HIV-free generation if the faith community stands up more than they are doing right now.
Pauline mentioned Balm and Gilead. It's a U.S.-based organization working primarily in the U.S., although some in Africa. Gertie is the chief operating officer of Balm and Gilead, which is now headquartered in Richmond, Virginia. It's a faith-based nonprofit organization working with the faith community nationwide, as well as in Africa, to build health ministries focusing on AIDS education and awareness, training and advocacy, as well as other health issues. And Gertie has quite a past, too, and the one thing that I will mention is that she spent some of her years working for the New York Health Department on AIDS. So she brings that experience to her work now with Balm and Gilead. Gertie?
Good evening, everyone. It's really great to be here, and I bring you greetings from Dr. Patricia, CEO, who is our CEO founder of the Balm and Gilead. The Balm and Gilead, we've been around for about 23 years. We just celebrated our 23rd anniversary, and the Balm and Gilead started out with just an idea by Patricia, CEO. She's an epidemiologist, and she came to New York when the AIDS epidemic first surfaced, and she was working at Harlem Hospital and just saw, you know, babies dying and people dying, and she was just so distressed. And she got an idea in her head, that we just need to start praying. The church needs to do something to support, people who are dying, the babies that are dying, people are sick. Everybody was afraid to even get involved, and she rallied the church community together and started out with what she called the Harlem Week of Prayer for the healing of AIDS. And that just developed into later, actually started out with a day of prayer. And then it went into a week of prayer. And 23 years later has developed into a national week of prayer for the healing of AIDS. And basically what we do is we mobilize the faith community all over the country around AIDS, HIV education, advocacy, awareness. We have several premier venues that we work with. We started out with a day of prayer for the healing of AIDS, then went to a week of prayer for the healing of AIDS, and now 2 years ago, we moved to a fully ecumenical and week of prayer for the healing, national week of prayer for the healing of AIDS, involving all churches, all religious groups, as well as ethnicities. And we're very excited about that. During the week of prayer, and I challenge each of you to please do something from your faith-based organization, from your church, for the National Week of Prayer for the healing of AIDS. It doesn't have to be anything special. Just acknowledge people who are infected and affected by AIDS, HIV. And that's the first, starting with the first Sunday in March through the following Saturday. Some churches do different things. Some might have a concert. Some might just have, might have a special altar call, a special prayer. But we challenge each of you to do something in your church for the week of prayer for the healing of AIDS and HIV. Some of the other things that we're involved in, we do have a project in Tanzania, Africa. Initially, the Balm was located in 5 different countries in Africa. Zimbabwe, Nigeria, Tanzania, and Cote d'Ivoire. But now we are in just Tanzania. And with that Tanzania project, Panessa was able to do something with the staff there that has never been done before. She was able to bring together the Muslims, the Christians, and the Catholic Church all together to put programs in place in the Tanzania area and serve as a role model for AIDS services such as orphan care, home care, couples, sexual counseling, and other areas of programmatic areas in the Tanzania area. So would like to just challenge each of you to do something for the National Week of Prayer for the healing of AIDS and support the Balm in Gilead. And if you want to find out more about us, our website is www.balmingilead.org. Thank you very much.
Next, we'll hear from Patricia Sawo. Patricia is a pastor from Kitale in northwest Kenya. She is living with HIV, and she is working in addition to her work as pastor, or part of her work as pastor, I should probably say, in gender and women's issues and public awareness of HIV and AIDS. She is a member of ANARELA. ANARELA stands for the African Network of Religious Leaders Living with or Personally Affected by HIV and AIDS. My organization, Christian Connections for International Health, has interacted with quite a few members of ANARELA. In the earlier days of the AIDS epidemic, the tendency in Africa and elsewhere too was to hide the fact that you had AIDS if you did have AIDS, or to pretend that it was something else. And it took a lot of courage for anybody to come out and say they had AIDS, and for a pastor to come out and say that they were HIV positive. was a real act of courage. And this Anarella is a fellowship of African clergy who are HIV positive or somehow affected by AIDS. Patricia, I want to say one thing about Patricia. With many Africans believing that AIDS was a curse of God, she had to contend with that attitude. But she went to her congregation with this message that countered the initial reactions that people had to AIDS, and built a community of support and understanding in the church community. And partly as a result of that, she was recently named as a CNN hero, mentioning that work. And she also established an organization that's working with orphans resulting from the AIDS epidemic, called Discover to Recover Center. So Patricia?
When God wants to do something, he can do it even with one person. And so I'm grateful that you came this evening. Thank you so much for coming. And I know that you are able to do more than you can imagine. I'm being tempted to preach. I've not come to preach. Amen. Let me talk a bit about my work in HIV. He has tried to talk about it. Early in those years, in 1999, when I tested HIV positive, still the church was not ready to say that HIV was in the church. Personally, I believed HIV was not something that was supposed to be in the church, and I preached it. And when I became HIV positive, it was a struggle. For the first 2 years, the church leadership said, we must not talk about this. And indeed, we didn't talk about it. We prayed for healing, and for 4 years, even after I went public with my status in 2000, for the next 2 years, I still fasted and prayed for healing. And God healed my heart by changing my heart and showing me that HIV and AIDS is not something that he would use to punish his people, that it was an opportunity for the church to stand up and be the feet and the hands of Jesus Christ and serve in such a time as this. I am here just to speak about the cut-up that Pauline has talked about. We know that as the American people, you have supported us, and I'm standing here as a person that is alive because of the money that comes from here that gives us the ARV medication. When I tested HIV positive in 1999, people were drinking different things. I was pregnant of my last born. And the regime that the doctor wanted to give me so that I would be able to give birth to a baby that is not having HIV at that time was $7,500. That was a salary of somebody in Africa. That was my salary. I worked with the government. There was no way I was going to be able to afford that. I and my husband struggled. And my husband struggled a lot because he was not a believer, to try and do everything else that he could do in order for him. He didn't even know his status because he believed his wife cannot be HIV positive if he is not. And so HIV and AIDS has made families lose even things that they would have never lost, just because it's a complicated, complex issue. HIV and AIDS has come with a face that no other disease has come with. For the last 30 years, HIV has been fought, and we have been losing the battle most of the times. But as per now, I would say that the progress has just been so good. But the enemy always wants something else. When the progress has been so good and things have been going on so well, the economical crisis has come up. And most of the donors are threatening to cut the funding that come from Africa. And even the American government is threatening to cut. And the reason is, it now seems as though HIV and AIDS information has reached everywhere. It now seems as though it has been here for a long time, and the long time has been enough for people to be able to do something for themselves and about themselves. But I'm here to stand as a testimony to you this evening, to let you know that HIV and AIDS cannot be wished away. We must stand for our brothers and sisters. We must advocate for our brothers and sisters, and God counts on you and me. And I'm saying this because there is no program that we can cut. We cannot say this program is no longer irrelevant. See, I've worked as a trainer from 2004, training pastors, and as I speak to you today, just 2 weeks ago before I came here, I was training pastors. There are still people outside there who do not know what HIV and AIDS is. They just know there is a disease that is called AIDS. A lot of public awareness that I do with church leaders. There are still many church leaders who believe that HIV is a moral issue, and it's because they've never gotten that right information. And I'm a living testimony for that, because in 1996, when I was the women's leader in church, when I talked to them about HIV, I never had any information about HIV. I tested HIV positive in 99. For 4 years, I didn't have accurate information about HIV. I didn't know what it was all about. It's only until 2003, when an ERELA was established, that I then began to get the right, accurate information about HIV. That is when I even understood myself. That is when I was able to overcome stigma. And that is when I started to really take care of myself. By then, my children were out of school. By then, some of the church members had asked me, just accept to die so that you may not continue deteriorating like this. You are going to die an undignified death. Accept to die. And at one point, I asked somebody, if I die, what about my children? And by that time, 2002, my children were out of school. When HIV comes, it takes away all that you have and leaves you useless. I was one person that had said I was raised in a poor family, and I believed my children were not going to live the kind of life that I was living. My husband believed our children were not going to live the kind of life that we lived when we were children, and we were trying our best. But when HIV and AIDS came, it took away everything. I lost my job when I went public with my status. He lost his job. The church asked me to hand over leadership. The landlord threw us away. We were building a house that we had taken loans. Our car had to be taken to pay the loan. It robbed us everything. And it was like our children's life were becoming worse than ours. It took me with pain watching my children in the house, 2002, none of them going to school. And for me, the most painful thing, if my mother, who was not as educated as I was, would educate me, and now my children were not going to be educated, that is another thing that made me say, I'm going to stand and fight and live. And the lady who came to pray with me, I told her, if the church was doing something better right now for my children, I would have accepted to die. But they are not in school. And what's more, somebody has come to ask me to give them my daughter to go and be a housemaid so that he gives us 2,000 shillings to live on. And it was painful. HIV and AIDS reduce even the quality of life that a family embraces. And so I look at my life today after having the correct, accurate information, and after receiving the ARV medication that I receive from PEFA funding that comes through an organization within the district where I am, I look at myself today. My daughter, who is my firstborn, that time was in Form 2. She now has a degree in social work and social administration. If I died, she could have been an orphan, she could have been employed the way they wanted to employ her, and she couldn't have made it. And as you are aware, most people just take orphans and they say, we'll give you tertiary education. And most of them don't even go beyond grade 8. So I look at my children today and I know that if I died then, things would have been different. But the question is, if the funding is cut, what happens next? Because of that, God in his own grace. I have 100 orphans that I take care of, and I would wish that they go through the same life that I would wish my own child goes through. I would wish that they go to school and finish school. Some of them are on ARVs. When I look at them and I hear that funding is being cut, I ask myself, if they cut the funding, where am I going to get medication for these children? Even getting money for their school and for their food, we struggle both with them. We struggle with them to raise the money. If now the funding for the drugs is cut, what will happen? I look at some of them who are still struggling with their own status, and I'm imagining if they cut the money for public awareness, if they cut the money for counseling, where are these children going to turn to when they need counseling? And this evening, I'm just here to appeal with you. I know that you are able to talk to 3 or 4 people that can influence the congressmen outside there. I know that as a person, you are able to do something that can make us stand. Together, we can make it. But if we are divided, we can never, ever make it. HIV might seem to be very far away, but it's not far away. And I want to say that HIV, the stigma makes HIV go underground. And you might be thinking HIV is not, even in this church, you could be thinking HIV is not there. But it is there. Because we don't talk about it, we just hear somebody has died. And because the doctor do not want to deal with it, the doctor feels ashamed of telling you you have HIV. The doctor only deals with the other symptoms that are there. Because the doctors are also just having the same stigma that we are talking about. Unless we understand the niche and some of the things, the issues that HIV and AIDS has brought up, there is no program that we can say is not good. But above all, the American people has done us good. And I want to say thank you very much. And I want you to use the thank you when you go to speak to somebody there. Begin with the thank you of the good that they have done. From where I come, 410,000 people are on ARVs. Many more need it because 2.1 million Kenyans are living with HIV. Many orphans are living with HIV. 673 orphans have benefited from support and care and ARVs. And there are many people who have not even known their HIV status. If we do away with the VCTs, we say we don't need them. If we do away, there is no program that we can say is not enough. But above all, I also want to say that the faith-based community has a part to play. And we also need to get up and rise above where we are and stand together and fight for the right of us as a church. The church is the only organization that is everywhere. You go to the villages. In our church, the first VCT center that was created right in the middle of a slum is the VCT center that is in our church. The other VCT centers were in posh, good places where somebody look at and they know if I go there, everybody will know that I'm HIV positive. But if I sleep here and go into the church, people will think I'm going to the church. Then I go as though I'm going to the toilet and I'm inside the VCT center and nobody will know that I'm inside that room and I'm done and I go away. I want to plead with you to stand with the faith-based organizations like the Balm and Gilead. Support them to be able to receive the global funding and bring it down to the grassroots for the churches so that we may be able to do the good work that we have started, the noble work that we have started, so that we may not erase the good work that you have started. And the challenge I leave you with today is that when they say HIV and AIDS, money is being cut, because you have seen me have my picture in front of you. And ask yourself, what about Patricia? And what about her 28 orphans that are on HIV, that are on ARVs? And what about the sisters of those children? And what about their grandparents? God bless you so much.
So finally, we'll hear from Tendai Kateketa Westerhoff, who is from Zimbabwe in southern Africa. Tendai was diagnosed with HIV in 2002, and since then she's been actively involved in testimonies, speaking in schools, churches, public places, advocacy with policymakers, and so forth. The bio I was given describes her as a motivational speaker, author, and fashion model. And I was wondering, I don't know, does Lewinsville Presbyterian Church keep a record of how many fashion models speak from the podium here? Well, we have one more tonight. And she's the protagonist in a documentary film entitled Growing Stronger, which is a story about women being women, mothers, wives, sisters, public figures in a time of HIV and AIDS. She also founded her own organization. It's called Public Personalities Against AIDS Trust, which works with high-level prominent personalities to draw attention to AIDS. And I think we can say that Tendai, as Patricia, are role models for living positively with AIDS. That's a term that we commonly use in the public health and AIDS community, living positively.
As you know, AIDS is a serious problem in every community. And the church for a long time has been silent on some of the issues that are affecting its members. And that those issues include HIV and AIDS. Whilst we appreciate that, we also have churches who have started this work. Some have been working on quite a number of years up to now, and they've made significant contribution in terms through their church-related hospitals and through programs that mitigate the challenge of HIV through orphans by providing support to orphans and vulnerable children. We still feel that the majority of the churches are not doing enough. And for your own information, I think the church is now the missing link in combating HIV and AIDS. Zimbabwe is a Christian nation whereby 80% are Christians, and these Christians gather on a Sunday service almost every week. Our population is about 14 million, so you can calculate by yourself 80% of 14 million. And one of those 14 million belong to a denomination one way or the other. So it is important that we start to get commitment from the church leadership as far as HIV and AIDS is concerned. It was not going to be possible for us even to come to this meeting today if the church leadership was not committed. So the same should be replicated to every congregation that is around DC area. The same should be replicated to every congregation where a church is in Africa and other parts of the world. We are aware and we appreciate the help that we have got from the US government through the various channels of funding that they've brought to Zimbabwe to mitigate the negative impact of HIV and AIDS through faith-based organizations. The US government has supported through PEPFAR a lot of programs in Zimbabwe, especially the procurement of antiretroviral drugs to people who have the virus. And there's a difference between a person with the virus and a person with AIDS. A person with the virus is the person that you see standing here to you today, facing you today. I don't have AIDS, I have the virus. And with the help of antiretroviral drugs, I can live with the virus and manage it for a very, very long time, you know. But a person with AIDS now, it is now a collection of different diseases whereby the immune system is gone. And we have come to a point that we are saying 20 years, 30 years down the line since the pandemic was discovered, we do not want to see any more death related to HIV. We want zero death, we want zero stigma of HIV, and we want zero new infections. But this can only happen if we have sustainable funding. Right now, we know that there is economic recession everywhere, and donors are cutting funding. It's not just the US government, but why the US government is unique is that it has been contributing much of the chunk towards that monies that were coming to Zimbabwe. through PEPFAR and through CDC, through the US Embassy, and through USAID, and also it is a big contributor to the global fund that fight HIV, TB, and malaria. And we feel that we now have emerging issues that have come with HIV, and it's time for a paradigm shift. It's no longer HIV, the disease itself, but we have to think about issues of women, girls, and families. The percentage of people who get infected every day, it's still women, girls, and children. This is now why all the world over, through the UN, they've now come up with a global action whereby we are saying we do not want any more infections of unborn babies or of newborn babies. We need to save the newborn babies and eliminate HIV to their mothers so that the children will have an opportunity to grow up with their mothers. And these words are not as simple as said. We need technical and financial resources to ensure that this elimination takes place. And also the other thing is that whilst we have VCT centers in the various countries where we come from, for instance in Zimbabwe, it's still not enough. It's only maybe the women who are in urban settings who have access to health services, but the majority of women still live in rural areas. Sometimes they live very far away from a hospital and from a clinic, and they live very far away from a testing center. And it's our responsibility to make sure that we keep the women alive. And the same applies to the young girls as well who are living in the rural areas. Despite the burden of HIV, they are facing other challenges, and the issue of poverty. Women are still economically disempowered. We have gender power relations in our communities that still render women, from achieving a lot of things. And with the gender, it doesn't matter whether it's a woman staying in America or in Asia or in Africa. The problems of women are the same. They are unique. They don't have power over the economy. How many presidents do we have of women around the country with also over 200 countries? Maybe it's a handful of 3 or 5. So it's still the same. How many women do we have in leadership positions, even in companies and businesses? It's still very few women. So you can imagine when it comes to issues of HIV and AIDS, women are still disappropriated, they are still disadvantaged. In a lot of ways, they are still vulnerable. They cannot even access the antiretroviral drugs that we are talking about. In my country right now, the population of people living with HIV, it's over 1.2 million, of which about 680,000 are women. And when you look at the ratio of the number of women who are accessing antiretroviral drugs versus the men, you discover that it's still very, very few women. So we need really to stamp up the effort, and the faith-based organizations, like the good work that they started, they can still continue to ensure that they also are a voice which can push our governments, to really take the responsibility of health into their hands, to protect their citizens from dying of HIV, to protect their citizens from further infection of HIV. So there are a lot of prevention strategies that can be done. And in the churches that I work with in Zimbabwe, we have managed to lobby and advocate that the church makes the issue of HIV and AIDS its core business as well, and give it the same attention to the prayer, to the sermons, to the worship, especially on a Sunday. Not to wait for it to be spoken about at a side meeting. It's good, but it's not enough. How many people turn up? We want to reach out to many. So we have introduced what are called HIV and AIDS 10-minute seminars. These are done during the main service on Sunday, just before the main sermon. We do small presentation of 10 minutes where we can touch on any aspect of HIV and AIDS. And the beauty of it is that the whole family is there. And while we are trying to address other issues of gender, the men that we also want to get involved will be in the church. The whole family will be in the church, because some of the issues of HIV and AIDS, families at home never gather to talk about them. And this has really created a good platform. And the beauty of it as well is that even the church leadership during that seminar, they contribute, they stand up, they make comments, they encourage their members. We refer people for testing, we refer people to health centers where they can access ARVs, and we discover that you find people coming out in the church to say, I'm living with the disease, I didn't know what to do, how should I cope? And furthermore, this is aimed at destigmatizing HIV and AIDS. And furthermore, we also hold capacity building workshops for pastors. And we have managed to lobby and advocate that every pastor now who goes through pastoral training at the institutions, HIV should also be a subject that they study. And some pastors are starting to major in HIV and AIDS issues. And we also target young women. We target single women. We target married women. Married women, we target them because the marriage institution, particularly in an African setting, and probably everywhere else, it's no longer a safe haven like before, whereby a married woman would boast to say HIV, it's next door. They had a low risk perception. But now, with our situation of our culture, there you find a man is what we call small houses. These are little unrecognized kind of improper associations that he or she forms with another man or other men outside or another woman outside, you know, and yet the person is married. And that kind of arrangement is putting a lot of married women at risk. And from the researches that were done, they also revealed that more women who are married are now contracting HIV than sex workers, because a sex worker is now empowered. She can negotiate and protect herself with a condom. But in marriages, even in some countries, our culture has adamantly refused condoms, and we have churches who refuse to talk, even to mention the word condom in the church. And if a woman who comes to the church, goes with a condom at the house, she's blamed of being a person who has loose morals or who has some kind of infidelity for possessing a condom. And yet sometimes the man is so astray, you can tell that your man is doing some things. He is likely to bring HIV into the home, but the woman is still powerless. So it is the duty of the church to address those gender imbalances through men's guilds. That is what we are doing in Zimbabwe. Men's guilds, men-to-men talk, whereby men talk about the problems that they encounter in their marriages and they bring out solutions. And we also have workshops for couples as well, whereby it's a free discussion led by couples counselors, and some of the pastors are also there. They talk about these issues. They are free discussion. And even in some congregations, we are even allowed to come with condoms and demonstrate how condoms are used. Because there is no need to talk about condoms when you don't tell people that they are used, how they are used. Yes, we can distribute 1,000 of them, but if people are not empowered on how to use them, we have wasted resources, you know. So we emphasize on the use of condoms, correct and consistent use to those people who feel that they need them. And we also have a big challenge of discordant couples in the church. And yet some churches decry condoms, but at the end of the day, when you have discordant couples, how do you assist those those people? We still have one person who is negative, and it is our responsibility to ensure that that person remains negative for a longer period of time, and also enjoy married life and enjoy a sex life. So if we keep quiet about prevention strategies, we are also perpetuating and putting that person into a situation that they contract HIV. So it's really important, and we have managed to capacitate pastors, and we have worked a lot with pastors' wives, because we feel that the pastors' wives sometimes have influence on their husbands too. They go and discuss it at home. Just like anywhere else, sometimes the women they can influence their husband to do things. And this has really worked, whereby the pastors' wives have mobilized even the community. When we say the church, we are talking about this church and the people that live in this community. This community is the responsibility of this church. So we are not just talking about the congregation of people who come on a Sunday. So we have made use of this leadership. Pastors' wives, they go in the community, they do outreach. They also distribute brochures on HIV and AIDS. They sit down with family to talk about the disease. But the first thing what we did was to capacitate them and empower them. And this is an ongoing exercise, because issues of HIV and AIDS are very, very broad. You look at the treatment aspect, you look at the prevention aspect, you look at the care aspect, you look at the support aspect, you look at the community home-based care, you look at palliative care, you look at continuum of care. So all these things, the church can play a role. And we look also at the mitigation on orphans and vulnerable children. So faith-based organizations can do a lot, and you can provide, a platform for your community to openly discuss issues about HIV and AIDS and health, to make it more interesting. Because sometimes when you say there's an HIV and AIDS discussion, people might lose interest. But if you talk about total health, it gives us an opportunity to talk about even high blood pressure, to talk about cancer, to talk about diabetes. You also include HIV and AIDS and good living, such as exercise and other things. And the other thing is that faced with the impact of this HIV and AIDS, I feel that religious leaders have a responsibility to call on the power and the word of God, to offer compassion, to offer reconciliation, prayer, and hope to all people who are living with HIV. And maybe when the church opens up more, you will see that this problem is also huge in your church, because you have created an environment for people to talk about it. That environment was not there, so people were dying silently with it and driving the virus underground with its devastating effects. We want our members, because if members are eradicated, we'll end up with no church. Church is the people. And also, I call upon the church leadership to become as aware as possible, including also examining personal attitude of the stigma, which my forerunners here were talking about. It is us who stigmatize others, and stigma is in the mind. Self-stigma, institutional stigma, this is what you find when you come into church. Community stigma, societal stigma in the communities that we live. And how many churches have an HIV and AIDS in the workplace policy? The church is also a workplace policy to an extent, whereby people are free, the church can assist people to go and access services, antiretroviral drugs, sexual reproductive health services for young women. Do we have that policy? So this church here can set the pace to start about working around those things. And also it's important that we gather the facts about what the impact of AIDS is having on men, on women, on children, families, and communities, including religious structures and the society and economy that we live in. We also want to promote discussion in the religious hierarchy in teaching and training institutions and individual places of worship in the community. Let's talk about HIV and AIDS and their effects, especially stigmatization and discrimination, to build consensus on positive actions needed. And also, we want to work with other religious leaders, faith-based coalitions, and political community leaders to find existing shared beliefs as far as HIV is concerned. And let's include those people who are living with HIV. They can come and help by giving testimony of how they are living positively with the disease, to encourage others who are shy to also go and find out about their status and plan for a healthy life. When you know your status, it's an entry point to treatment. If you don't know your status, you cannot be treated. And if you don't open it up, if you are not able to talk about it, people cannot assist you. By these few words, I would like to thank you, to thank the Balm and Gilead, to thank the leadership of this church and all the partners who have been involved to make this event possible. We believe this is a beginning of a lasting relationship. Thank you.
Thank you. I wanted to thank Patricia and Tendai for their testimonies, and also for giving us the push to try and connect with policymakers, especially on the issue of HIV and AIDS funding cuts. I was going to ask them to see if they have some suggestions as to how best we could address stigma and discrimination. I work for the Pan-African Christian AIDS Network, and we work with churches and Christian organizations to see how they can step up their HIV and AIDS activities to address the problem. Now, one of the items on our list is addressing stigma and discrimination. We do a lot of training for church leaders, but I was wondering if you have any suggestions as what else should we be doing, and how best to do that.
Okay, one way of doing it would be for the church to make it normal to talk about HIV and AIDS. Though there is still no known cure for AIDS, but make it normal to talk about it. And when people come to you to seek counseling as an elder, as a deacon, as a pastor, give them that assurance of confidentiality over the issues that you want to talk to them about. Start church activities. You start slow, and they grow. You end up forming support groups, and everything else will start to fall into place because the environment will diffuse and it will become acceptable, and people will voluntarily come forward. And also voluntarily, and they become willing to participate.
Thank you. I want to say the first place to begin is to identify stigma. Most of the times we just talk about stigma, and people do not really understand what stigma is. So for you to be able to effectively address the stigma in your place, you need to know what brings stigma in that particular place where you are. Why is it that there is stigma in that congregation? Why is it that that congregation is not able to address it? And as Anorella, we came up with a tool. There is a training called Channels of Hope. Channels of Hope training is a manual that will take you through from attitude change. After changing people's attitudes is when you begin talking about HIV and AIDS. If somebody has an attitude with HIV, you can never, ever change them and make them understand. For 4 years, I believed it was a punishment and a curse. So I had it, but you could not bring anything to me and I would not receive it. I would reject everything that you are talking about. So the first step is to change people's attitudes towards HIV. And then you give them the accurate information. Let the pastors understand HIV is not a demon. It's a virus. If possible, show them. Because now there is even a picture of what the virus looks like. Show them what it is. It's not a demon, it's a virus. Then give them the accurate information. Thank you.
And the basis of all of that is the love of Christ. If we were to love one another as Christ asked us to love each other, we would not stigmatize the way we do. But unfortunately, we interpret scriptures in a way that it condemns those who are different from us. It also condemns those whom we think are sinners. And we forget that we are all sinners, but by the grace of God. So I think that's the beginning for me, the love of Christ. That's where we begin.
How do you approach your growing children to prevent this when you talk about sexuality? And it's special, I have myself 3 sons, and you talk about it, but the oldest had a scare that he thought he had AIDS, and he said, I don't know, don't you ever use your brains when you go out? And because there must be a much more scare between the youngsters and what they are doing. How is that in your schools and in your society approached? How to prevent it?
A good question. In Zimbabwe, in schools, we do have youth clubs where they talk about issues of health. But the policy for our government is that you cannot talk about prevention strategies such as condoms in schools. And the danger which is there is that a lot of families do not want to discuss openly these things with their children. So the children will watch this, will see these things on the internet, they'll read magazines or even peer pressure, and they will end up experimenting. And we may think that our children don't know, but life has changed from when we were born 40 years ago and so forth. The children of today, I tell you, they know almost everything. So I think as parents, we should just open up. And even in the church, have meetings for children. I'm sure you have youth meetings for children only, for the young people only, And it is such platforms that this discussion can actually be stimulated. And you hear what they say. You ask them, so what do you want us to do? And they will tell you how they want this whole thing to be approached. They come with solutions themselves, but don't tell them what to do. So maybe it's another way that can also assist.
Thank you. The mistake I ever done in my life was to threaten my husband every now and then he left the house. Watch out, don't come back with HIV. If we use HIV and AIDS to control people, we will never, ever go anywhere. We would rather teach our people to control HIV than want to control our people with HIV. And most pastors control their congregations by HIV. When I say control, it means that you threaten somebody with HIV. We need to give the accurate information. Right now, HIV is preventable. AIDS death is avoidable. And somebody doesn't have to die of AIDS. If they want to get involved in sex, because you can never change anybody, it's only God who changes people's hearts. If they want to get involved in sex, let it be safe sex. Safe sex means that they know their HIV status, they know the HIV status of the person they want to have sex with. If that person is HIV positive and they love them so much, they think they must have sex with that person, let them use condom. If all of them are positive, are negative, tell them there are other diseases that are worse than HIV. Hepatitis B is worse than HIV. Have you tested for that? So the best is to give people the accurate information. Then they make informed decisions. But threatening people with HIV and AIDS can never take us anywhere.
And also life skills education for young people, it's very, very important.
It's not really a question. I just want to thank you for coming and present that great testimony, because HIV/AIDS has been around, and there's still a lot to be done to really get everybody on board so we can all fight against this pandemic. Church leaders, I've been around some of them because I'm a pastor kid, and a lot of them also contribute to the discussion we're talking about stigma. And we still need to educate them because they need to lead the community, make AIDS, HIV/AIDS, one of the normal things to discuss in church as we discuss everything else. This is the only way we can really make a good stride against HIV/AIDS. We need to advocate for Congress not to cut the funding. And I wonder if you are also advocating in your country for your government to put more funding in the fight against HIV/AIDS.
Thank you very much. Yes, one of our main objectives of being invited to Washington was to advocate with congressmen, and we are doing that every day. And the good news is that they are so embracing, they are understanding, they are taking this very, very seriously. Back home, as you all know, that most African countries are signatories to the Abuja Declaration, which says 15% of health budgets per each country should go towards health. But it's still far-fetched, but that doesn't silence us as advocates. We continue to talk with our parliamentarians that we want to see that 15% going towards health. And we keep driving the fact home to say government is responsible for the health of its citizens. Whilst we appreciate that donor funding and other partners are contributing, the first responsibility lies with the government. Donors are only coming there to complement what we have, and we should not be complacent.
We are pushing through advocating, but Africa is still far away. There are also debts that these governments are paying, and there is corruption, which I'm not ashamed to say, because unless you uncover some of the things, you cannot be able to solve them. There's also corruption, and we must just push on and pray and talk and advocate, as she has said.
I think one of the greatest challenges for the church is talking about human sexuality. And we are so afraid of talking about human sexuality, and we will not have significant progress if we don't talk in the AIDS epidemic, if we don't talk about human sexuality in its comprehensiveness, not just one section, but the whole of it. You know, because when you are open and ready to discuss about the different dimensions of human sexuality, then you'll be able to equip people, your parishioners, to better protect themselves and also to live positively, healthy and productive life with HIV. And the one thing that I have been calling along, for the faith community is the fact that the faith community, many of them have been up front saying they are pro-life, so protecting children who are unborn. But I don't see them being proactive in protecting children from being born with HIV. There is evidence, scientific evidence, that a mother who is HIV positive can give birth to a child who is HIV negative, given the medication and the circumstances of birth, that she will be able to give birth to a HIV-free child. And I'm challenging all churches, I'm calling upon churches that if there is anything that you can do is to work towards saving the lives of these unborn children by providing the medication that they need and also keeping their mothers alive so that they can raise them. Because you don't save the child and then the child comes and dies because it didn't have the mother to take care of it. So it's saving the children from getting infected and then keeping the mothers alive. And that's a role that the churches can play. Some of them don't even advertise in their congregation to say that how many of you who are pregnant in this congregation have had a HIV test. That question alone, from the pulpit, from a pastor, would save someone in that congregation. But most of them are still afraid. How many of them will even say, okay, you are married, but how many women are you going with out there? And how many condoms are you using with your wife or with the women out there? That's the frank conversation that needs to happen in our churches. Thank you.
Well, this has been a pretty powerful evening. Thank you all for